Hemorrhoids, also called piles, are swollen veins in your anus and lower rectum, similar to varicose veins. Hemorrhoids can develop inside the rectum, internal hemorrhoids, or under the skin around the anus, external hemorrhoids. Nearly 3 out of 4 adults will have hemorrhoids from time to time. Hemorrhoids have a number of causes, but often the cause is unknown. Fortunately, effective options are available to treat hemorrhoids. Many people get relief with home treatments and lifestyle changes. Symptoms. Signs and symptoms of hemorrhoids usually depend on the type of hemorrhoid. External hemorrhoids. These are under the skin around your anus. Signs and symptoms might include itching or irritation in your anal region, pain or discomfort, swelling around your anus, bleeding. Internal hemorrhoids. Internal hemorrhoids lie inside the rectum. You usually can't see or feel them, and they rarely cause discomfort. But straining or irritation when passing stool can cause painless bleeding during bowel movements. You might notice small amounts of bright red blood on your toilet tissue or in the toilet. A hemorrhoid to push through the anal opening, prolapse or protruding hemorrhoid, resulting in pain and irritation. Thrombose hemorrhoids. If blood pools in an external hemorrhoid and forms a clot, thrombus, it can result in severe pain, swelling, inflammation, a hard lump near your anus. When to see a doctor. If you are bleeding during bowel movements or you have hemorrhoids that don't improve after a week of home care, talk to your doctor. Don't assume rectal bleeding is due to hemorrhoids, especially if you have changes in bowel habits or if your stools change in color or consistency. Rectal bleeding can occur with other diseases, including colorectal cancer and anal cancer. Seek emergency care if you have large amounts of rectal bleeding, lightheadedness, dizziness, or faintness. Causes. The veins around your anus tend to stretch under pressure and may bulge or swell. Hemorrhoids can develop from increased pressure in the lower rectum due to straining during bowel movements, sitting for long periods of time on the toilet, having chronic diarrhea or constipation, being obese, being pregnant, having anal intercourse, eating a low-fiber diet, regular heavy lifting. Risk factors. As you age, your risk of hemorrhoids increases. That's because the tissues that support the veins in your rectum and anus can be weakened and stretched. This can also happen when you are pregnant because the baby's weight puts pressure on the anal region. Complications. Complications of hemorrhoids are rare, but include anemia. Rarely, chronic blood loss from hemorrhoids may cause anemia, in which you don't have enough healthy red blood cells to carry oxygen to your cells. Strangulated hemorrhoids. If the blood supply to an internal hemorrhoid is cut off, the hemorrhoid may be strangulated, which can cause extreme pain. Blood clot. Occasionally, a clot can form in a hemorrhoid, thrombosed hemorrhoid. Although not dangerous, it can be extremely painful and sometimes need to be lanced and drained. Prevention. The best way to prevent hemorrhoids is to keep your stools soft so they pass easily. To prevent hemorrhoids and reduce symptoms of hemorrhoids, follow these tips. Eat high-fiber foods. Eat more fruits, vegetables, and whole grains. Doing so softens the stool and increases its bulk, which will help you avoid the straining that can cause hemorrhoids. Add fiber to your diet slowly to avoid problems with gas. Drink plenty of fluids. Drink 6 to 8 glasses of water and other liquids, not alcohol, each day to help keep stools soft. Consider fiber supplements. Most people don't get enough of the recommended amount of fiber, 20 to 30 grams a day, in their diet. Studies have shown that over-the-counter fiber supplements such as psyllium, metamucil, or methylcellulose, citrusel, improve overall symptoms and bleeding from hemorrhoids. If you use fiber supplements, be sure to drink at least 8 glasses of water or other fluids every day. Otherwise, the supplements can cause or worsen constipation. Don't strain. Straining and holding your breath when trying to pass a stool creates greater pressure in the veins in the lower rectum. Go as soon as you feel the urge. If you wait to pass a bowel movement and the urge goes away, your stool could dry out and be harder to pass. Exercise. Stay active to help prevent constipation and to reduce pressure on veins, which can occur with long periods of standing or sitting. Exercise can also help you lose excess weight that might be contributing to your hemorrhoids. Avoid long periods of sitting. Sitting too long, particularly on the toilet, can increase the pressure on the veins in the anus. Treatment. Home remedies. You can often relieve the mild pain, swelling, and inflammation of hemorrhoids with home treatments. Eat high fiber foods. Eat more fruits, vegetables, and whole grains. Doing so softens the stool and increases its bulk, which will help you avoid the straining that can worsen symptoms from existing hemorrhoids. Add fiber to your diet slowly to avoid problems with gas. Use topical treatments. Apply an over-the-counter hemorrhoid cream or suppository containing hydrocortisone, or use pads containing witch hazel or a numbing agent. Soak regularly in a warm bath or sitz bath. Soak your anal area in plain warm water for 10 to 15 minutes 2 to 3 times a day. A sitz bath fits over the toilet. Take oral pain relievers. You can use acetaminophen, Tylenol, others, aspirin or ibuprofen, Advil, Motrin, IB, others, temporarily to help relieve your discomfort. With these treatments, hemorrhoid symptoms often go away within a week. See your doctor in a week if you don't get relief, or sooner if you have severe pain or bleeding. Medications. If your hemorrhoids produce only mild discomfort, your doctor might suggest over-the-counter creams, ointments, suppositories, or pads. These products contain ingredients such as witch hazel or hydrocortisone or lidocaine, which can temporarily relieve pain and itching. Do not use an over-the-counter steroid cream for more than a week unless directed by your doctor, because it can thin your skin. Minimally invasive procedures. For persistent bleeding or painful hemorrhoids, your doctor might recommend one of the other minimally invasive procedures available. These treatments can be done in your doctor's office or other outpatient settings and don't usually require anesthesia. Rubber band ligation. Your doctor places 1 or 2 tiny rubber bands around the base of an internal hemorrhoid to cut off its circulation. The hemorrhoid withers and falls off within a week. Hemorrhoid banding can be uncomfortable and cause bleeding, which might begin 2 to 4 days after the procedure, but is rarely severe. Occasionally, more serious complications can occur. Injection, sclerotherapy. Your doctor injects a chemical solution into the hemorrhoid tissue to shrink it. While the injection causes little or no pain, it might be less effective than rubber band ligation. Coagulation, infrared, laser, or bipolar. Coagulation techniques use laser or infrared light or heat. They cause small bleeding internal hemorrhoids to harden and shrivel. Coagulation has few side effects and usually causes little discomfort. Surgical procedures include external hemorrhoid thrombectomy, hemorrhoid removal, hemorrhoidectomy, hemorrhoid stapling. And thank you for watching. Please hit the subscribe button below to watch more great videos.